There we go. All right. So the first thing we're going to do is I just want to welcome you guys. It's great that you're all here. It is exciting to be welcoming you all here for ROMA for Board Training Series. I am Susan Carr. I'm the Executive Director of the CSBG State Association, known as the Community Service Network of Wyoming, or CSNO. And I'm here to kind of go over some of, I guess, what is viewed as one of the most challenging pieces of being on a tripartite board. Just as a little brief background for who I am a former community action agency executive director. My dog's getting into all the garbage. I have been a subrecipient, a eligible entity. I have served on a tripartite board. I've worked really closely with the state. I am a ROMA trainer, and I've been working with CSBG funding since 2010. So I've been doing this for a long time, and I've seen a lot of changes and a lot of things adapt as they go through the processes. As we know, everything changes all the time, and we see things evolve. One of the things I want to be brutally honest about is Wyoming has a long history of being out of compliance with the CSBG grant at the federal level. And one of those reasons is because we have had constant turnover at the state office. And we have recently got somebody in that position now that has been there for a year. There is no intention of them leaving. We're seeing some really exciting things happen from the state office, and we're seeing a lot more attention to compliance. There has been not as much oversight as there probably should be. So we're seeing a lot of requests, demands, changes, things that we have to do where we're saying, we've never had to do that before. I don't understand where that's coming from. And so I wanted to kind of just highlight that. These are things that have been in place at CSBG for a long time, and we'll kind of talk about that a little bit. But we just want to make sure that we're doing everything we possibly can to make sure that we are compliant and using this federal funding in a way that we can be accountable for. CSBG is a very unique federal funding stream. It is one of the very few federal funding streams that has the flexibility that it does. And we're going to talk about that in more detail. Unfortunately, with that flexibility comes the opportunity for malfeasance and abuse and misuse of funding. That has never been an issue in Wyoming. We have always had very, very good people running this fund. But one of the things we always want to know is, are we doing what we said we're going to do, that we said that we were going to do? And that's why some of the things that are being asked of us are being asked of us. So I really want to start off by, first of all, thanking you. Being a board member is hard work. None of us have the time to do a lot of the board work and do a lot of the things that are being asked of us. And we find that CSBG can be so task intensive sometimes that it's just like, oh my gosh, how are we going to do all of this work? And there are ways, and using and implementing ROMA in the way it was intended to be using is one of those ways that we can do a great job. And this opportunity is really allowing us as board members and as senior leadership of our agencies to really lift up our agencies, to strengthen our already strong agencies and find better ways to support the work that we're doing on the ground. Our job, and our only job, is to eradicate poverty. That is what we have been tasked with. And addressing the causes and concerns of poverty in our community is not an easy task. Poverty is an incredibly complicated issue. If it was just a matter of just throwing money at a situation, we might have been able to solve poverty a long time ago, but that's not how it works. We really want to make sure that we're acknowledging that we haven't always done a great job in addressing the causes and concerns of poverty. We could be doing better. And that is where we've come in at ROMA, the management, the accountability piece, and what we do in our daily work to make sure that what we're doing is effective. As I mentioned earlier, ROMA has a little bit of a bad reputation, something that was done to us and not for us. It was always used as a piece of our organizational standards without anybody really understanding what the value was or why we were being forced to do it. It became a box that we would just check off and then never revisit it again. And I'm really on this personal mission to, again, demystify that ROMA process and turn it into something that is viewed as valuable and as good operating principles to move any business or agency forward. So as we move forward, we're going to talk about some of the learning objectives that you see up on the screen. Today and through this whole series, we're going to learn about the foundational concepts that help us increase our performance measurement and management capacity so that we can accomplish our goals. We're going to learn about the basic elements of results-oriented management and accountability, or ROMA. We're going to discuss the cycle. We're going to talk about how it fits into the organizational standards and our performance management framework, that how it all works together. And then we're going to understand, by the time we're done here, we're really going to understand how we can meet and exceed organizational standards by a renewed focus on the ROMA cycle. So we look at ROMA and we're like, what is it again? Yeah. ROMA is a planning framework. That's all it is. It is a process that we use to address the causes and concerns of poverty in our communities. It stands for results-oriented and management accountability. That's it. It asks us to use the data and information that's all around us, the unique knowledge that we have about our community, our friends, our families, our neighborhoods, to really decide what is the best way we can serve our communities and move families out of poverty by focusing on results. Not how many pounds of food we distributed, not how many utility bills we paid, not how many prescriptions we assisted paying for, but really tracking the outcomes, the results of the services. What changed? What made a difference? What was that difference? And why does it matter? We also are going to focus on their agency's accountability of the services that we provide. Did we do what we said we were going to do? How do we know that? How do we tell our story across the community to show how powerful community action can be in the fight against poverty? But at the end of the day, we are also mandated by federal law and our organizational standards to do these things. Since 1996, we saw the full implementation of ROMA across the national network. It's now intertwined with all of our federal funding authorizations, our federal reporting that we have to do on an annual basis, and our organizational standards. So we see this in everything that we do at our agencies. Now, I'm going to use a couple of terms that you may or may not be familiar with. It really kind of depends on how long you've been on the tripartite board and with your agency. But you'll hear me use the term Community Action Agency. And by virtue of receiving CSBG funding or Community Service Block Grant money, you are an agency that is called a Community Action Agency. That term was coined in 1964 in the President Johnson administration on the the Economic Opportunity Act, or the War on Poverty. Along with CSBG funding or community action, we saw the beginnings of Medicaid, Medicare, Head Start, Vista, Job Corps, all these programs that were put in place to help address poverty across the United States. Our mission since 1964 has never changed. It has been to eradicate poverty. As I mentioned earlier, obviously we have not done that. Have we made a dent in it? Yeah, we have. We've made a substantial dent in poverty. Um, Things changed a little bit when the COVID era hit. Once we hit the worldwide pandemic, we saw more people fall into poverty than we had ever seen before. We are now kind of what we consider the post-COVID era. We are seeing the reduction or the ending of a lot of the stimulus packages that were coming through to help people get through this COVID period. And community action was a big part of that. So we'll kind of talk about that a little bit later, but I really urge you, this is not a formal process at all. I'm not a formal teacher that's up here to just preach at you and talk to you. I really want to answer your questions, to help find ways to make this make sense in the space you occupy as a tripartite board member. We have a lot of responsibility as tripartite board members. We are overseeing, in some cases, hundreds of thousands of dollars that come into our county to help people, our neighbors, our friends, our family, our people who need help, the most vulnerable among us. Some of us only get a couple tens of thousands of dollars. And so we really have to look at ways, how do we best use the resources that are available to us to help the most amount of people and make true lasting change in people's lives. So we have a huge responsibility, and this is part of what we will be doing through this series, is talking about that. So I urge you, raise your hand, just take yourself off of mute. Say, I have a question, I don't understand that. If I ever use a phrase or a word that it doesn't make sense to you or you've never heard before, stop me, because let's talk about it. I am not going to come into this assuming everybody is in the same place as far as your knowledge level about CSBG, because I've been in it since 2010. Dirk, how long have you been serving on your tripartite board? I don't know if you have the ability to unmute if you have a microphone. If you are, can you tell us how long you have been serving on the board? While he's looking for that. Deb, how about you? How long have you been serving on your tripartite board?
I am brand new.
Brand new. Awesome.
Brand new. I've attended one meeting through Zoom, so.
Awesome. Christina, how about you? How long have you been on your tripartite board?
I think I'm almost going on a year.
Okay, great. So I think Dick's been on for a while. So we have this wide range. Okay. And I think he might be having some problem getting to his mic to work as my dog jumps on me. So please feel free to take yourself off of mute anytime. Stop me when I'm talking about something that is unfamiliar. Deb, all of this is going to be unfamiliar for you. This is not going to be an introduction to CSBG. I don't know at what point, and actually maybe I should ask you, what county do you sit on?
I'm on the Bighorn, Johnson, and
God,
Sheridan
yes,
County.
Sorry, Deb, I'm sorry.
I met you for my first Zoom, I think.
I did not make that connection. I am so sorry.
That's all right. You see a lot of people, so.
Oh gosh, I do. Thank you for your grace on that one. And Christina, are you in Fremont County? Do I have that right?
Yep.
Okay, awesome. Okay. So all of us have different kind of experiences and so forth. We will go through it again. If you ever get to the point where you're like, oop, you're talking about something I'm not really familiar with, stop me. We'll talk about it. We do have a little bit of time. Everything that you'll find in CSBG happens in a cycle. We are just finishing up the org standards, the organizational standards, which is a performance framework to make sure that our agencies have the capacity to do the work that we're asking them to do. That goes back to the fact that CSBG is an incredibly flexible form of spending. And so the feds and Congress want to make sure that we're not just willy-nilly spending money, right? We have the actual capacity in our agencies to be able to do this work. Next, we'll be going into annual reports. This is where we gather all the data that we have collected over the past year and we send it up to the feds. They then report all of that data to Congress so they can see what our progress is. We'll then be going into the application process and planning for 2025. While this is all going on, we're going to be providing services. We're going to be working with families and individuals and households experiencing poverty. We're going to find ourselves unable to meet all the needs that we're seeing out there, but we're going to be trying to do our best. There's a lot to do and it's very, very busy, but we're going to figure it out. So what we're going to do in this series is we're going to talk about our community needs assessments. We're going to talk about theories of change, our planning. We're going to talk about the work that we do through implementation of services and strategies. We're going to talk about how we observe and report our results. And then we're going to talk about the analysis and the evaluations of our programs. All of these things are required out of a tripartite board as part of the agreement that we take on when we agree to take CSBG money. I do have to say this presentation is a part of a series that is intended for Community Action Agency board members and helping community action agencies increase their capacity and their results. It's put together using materials. Can you tell I'm reading? It's put together using materials from the Federal Office of Community Services, the National Community Action Partnership, the National Association of State and Community Action Programs, and the National Association of Certified ROMA Trainers and Implementers, of which I am one. But primarily this is for you, the board members, and outlining your role in designing programs and services to help fight poverty and make a difference in your community. Okay, before we get started, any questions? All right, here we go. All right, so what we're looking at right here is called the ROMA cycle. In this series of presentations, we're going to be talking a lot about this ROMA cycle. This is part of the performance management system that I referenced earlier, and it's pretty unique to the CSBG Community Action Network. I'm going to talk about how the ROMA cycle, as seen here, is embedded into the organizational standards and that annual report I just went over, as well as some other like functional pieces of CSBG management. We know that there are some really big differences in how public and private community action agencies are governed. Right now, Bighorn County, Fremont County, you guys are public agencies. I'm not quite sure what Dirk's agency is, if it's public or private. But in both cases, your board has a role in assuring that your agencies are being operated with a results-oriented perspective. So as you look at this ROMA cycle, you can probably look at other business models or think of other business models that have a really similar approach. And we're going to go over each one of these phases of the ROMA cycle in more detail, but let's just start off at the top of the assessment and look at, or at the top of the cycle and look at assessment. So this is where the organization has to find out or verify what the community needs and what resources are already in place, right? It doesn't do us any good to be duplicating services that the agency down the street is doing. It's not going to do us any good to only provide GED classes if the biggest need in our community is housing assistance, right? So we have to know what our community needs. And we do this through several different ways. We look at our data from last year. We look at our data from our community needs assessments. We take a look at our strategic plans. And this is really the foundation on which our organization plans and carries out the mission or the work that we're going to do. This is our services and our programming. We figure out what's needed in our community during our planning phase. And we decide, hey, what are we going to do? It looks like our community really needs help with transportation. Let's see what we can do to start public transportation resources in place. So that's what we look at in our planning phase. Once we start doing the work, that's the implementation phase. Once we've provided the service and our work is complete, we start looking at and observing the outcomes to see, hey, what happened here? We start our counts, right? We start counting. Okay, we did this many rental assistant payments, or we did this many utility payments, and we start looking at what happened as a result of the service that we provided. Finally, we then start looking at the data, and this is what we start doing as we get ready for our application process that's going to happen in April. We start looking at 2023, program year 2023, and we're like, all right, here's our data. This is what our outcomes were. This is what all of our data says we did. This is what we said are the recipients of our services or our programming. They said, this is what was important to them. This is what they said their outcomes were. Did we do what we thought we were going to do? Did we do what we said we were going to do? And then we look at the, this leads to questions, right? It leads to finding new questions about our needs, our resources. Like I just said, did we do what we said we were going to do? Did we run out of money? Did we have enough money? Did we not utilize our funding correctly? Did we not achieve anything? Which means that we go back to doing our assessment work, right? It's a perfect little circle. Where is it? Because sometimes we want this movement to go clockwise, as I just went through it, but sometimes it just doesn't work that way. Sometimes life steps in and things get broken. And sometimes steps are started because a question gets raised in another section and we're like, wait a second, what are we going to do? We've got to go back and forth as we complete our program year. At the federal level, they talk a lot about rapid cycle learning systems that we use at a micro level of an agency that keeps track of progress as we're moving through implementation and achievement. Because we're always evaluating, we're always looking, we're always checking in. Are things going the way we expect them to? Why and why not? Sometimes major events happen in our communities that change the way we're going to have to look at it changes our plans. We planned one thing and then all of a sudden a major employer shuts down, or an environmental disaster occurs, or a worldwide pandemic happens. These are all reasons why this cycle is in perpetual motion. And this is why we develop a culture of data and asking questions all the time about is what we're doing working? So why a results-oriented approach? It's really important for boards to understand why results orientation is the focus of our performance management requirements from Congress. Why is reporting on services provided by your agency just not enough anymore? Historically, we've always counted our services. We've always collected data. We've reported on the number of food boxes we sent out the door. We reported on the number of children attending Head Start programs, or as I mentioned earlier, the number of adults that attended our GED program, or lately everybody wants to know how many rent payments we helped with, or how many utility payments we were made on behalf of those experiencing poverty. And those things are important to know. We have to know how many things we did. But when did counting those services just not become enough? Because we've been serving our community since 1964 with a Congress mandated task of eliminating poverty, we have to constantly be asking ourselves, have we been successful? And as I mentioned earlier, no, we haven't. And there are a lot of reasons for that. But in order for us to be accountable for the nearly $1 billion in CSBG funding that Congress gives us every year, we need to start being outcome focused. We have to start looking at the change that our agency helped provide. We started asking these questions through different ways, right? What changed in that family because of the work our agency did? We started asking what changed in our community because of the work we did. What did we change in our agency that made these changes possible? What was the outcome of paying rent and paying for its utilities? And what did we accomplish what we set out to do? And how do we know that? Again, it's important for us to know and be able to talk about these services that your agency provides, but you have to be able to identify the interventions that produced results. What changed because of agencies' work that they did? It's not enough for us to know we spent $10,000 on rent payments. What we need to know is we prevented 10 families from becoming homeless or being evicted. And being evicted is a horrific thing to be in the state of Wyoming, particularly in the wintertime and particularly in our current housing climate. I'm going to give you a story of why that matters. In Sheridan, where I'm based out of, we are about 5 years away from being Jackson Hole. Our rents are out of control. We don't have enough housing to go around. It's cheaper for us to help people make rent payments than have them evicted, because if they are evicted, they are now looking at $2,000 to $3,000 a month for rent, $2,000 to $3,000 a month $2,000 to $3,000 for first and last month and deposit. So in some cases, these families are having to come up with upwards of $8,000 to $9,000 before they can even move into a place. That's if they can find a place to move into, because we have a shortage of about, I also sit on the Sheridan County Attainable Housing Council. We have a shortage of about 200 units right now of what's considered to be affordable and attainable housing. So if they're evicted, there's literally nowhere to go. It's incredibly expensive then for a community, a state, and a nation to deal with homeless individuals. We don't have shelters. We don't have enough hotel rooms to put people in. We don't have enough resources. And now we start talking about kids missing school, kids not getting nutrition, kids dropping out of school because they have no way to get there because there is no transportation. So you can see where this just builds and builds and builds. So traditionally and historically, we've been asked, how many rent payments did you make? Doesn't matter how many rent payments I made. What I want to know is what changed. What did we prevent from occurring because of those rent payments that were made? Another example of that is baseball. So let's talk a little bit about what results focus means when we think about our local baseball team. So our local team finished last in the prior seasons. They're just awful. They were in last place. I'm talking to all my Bronco fans here, right? So to boost dwindling attendance, the team promotes. Yeah.
This is Dick. I have a question.
Yes.
In all those questions you ask, and I don't know whether they do it or not. Do we keep track from one year to the next if we have a reoccurring client?
We do. We do. And Dick, that's an excellent question. So
if somebody goes out, do we know if they were successfully out of poverty or did they just leave the program?
That is an excellent question. And Dick, that brings up our planning and our evaluation, right? So some agencies are going into a case management model. Some agencies are staying in an emergency services model. There is evidence that shows us that to move people out of generational poverty is a lot harder than situational poverty. So I'm going to give you an example. We have a single mom who's raising children. She's getting by. For the most part, she does okay. Child falls in the backyard, breaks their arm on the swing set. Because of that unexpected bill, that puts them behind. They're unable to meet their rental payment for the next month. So they reach out, they get help with their payment. Once that payment is done, they are fine. That they caught back up. That was a one-time emergency service payment. That's for situational poverty, and there's a place for that. The case management model is for families that are looking at generational poverty, generational trauma, a whole lot of different factors that go into that. It could be related to poor health. It could be related to lack of education. It could be a lack of resources. There's a whole lot of reasons why somebody might be experiencing generational poverty. Emergency services does not help that person move out of poverty. Emergency services keeps that person in poverty and actually makes them dependent more on the emergency service that they are receiving. It can, in that case, make them in a position where they are dependent. Every first of the month, they're coming back for that rental assistance. Every month, they're coming back for their food assistance. Every month, they're coming back for their utility assistance. We see this a lot. We call those our frequent flyers, right? So unless we address the underlying causes of poverty, of what is causing this cycle of poverty through case management, there's a lot of throwing good money after bad. And not because the family is not motivated to change, they're not motivated to become self-sufficient, but because there is a lack of resources to really promote lasting change. There isn't the resources there to help them to get back to school, to increase their education level, to get a higher paying job. There isn't resources there to help them treat untreated mental health issues or untreated medical issues that are keeping them from being able to hold permanent jobs. There isn't enough money to help them with long-term transportation issues that keep them from being able to get to work. So there's a very complex issue at play. I'm going to give you an example of Community Action of Laramie County. They went from a program of serving thousands of people every year to now serving 15 families. And the community lost their mind. They're like, how do you, we can't do this. We were helping all of these people. And now you're telling me we're only going to be helping 15 people? And the answer is yes, but we're helping these 15 people in a holistic, comprehensive way that truly gets them back on their feet into a level of self-sufficiency so they are no longer experiencing poverty and breaking that cycle for future generations. The outcomes of this. Their first year of doing this, 15 people took the program. 12 people graduated from that program. 5 years later, 10 of those families are still outside of poverty. They are no longer living in poverty. They are not living on any state or federal national assistance. One of them is now an executive director of an agency doing this work, making a living wage, and has obtained a degree because of the help that CSBG funding was able to do. These are very unique situations. I understand you do this program 10 years. Now you've got 150 families in Cheyenne that are no longer experiencing poverty. To answer your original question, Dick, do we have a way of tracking families that are coming back? Yes, we do. And those are outcomes. We have to be able to know, why is this person either not moving forward? What's the barrier? How can we help them move forward? There are going to be people who choose not to not follow that, and that's their choice. But that doesn't mean that the agency has to continue serving an individual who chooses not to move forward. We want to be able to use our data, find out what works, find those individuals who are interested in moving forward and making permanent, lasting change in their lives, and deploying our resources for them. So what do? We use CAP 60 as a statewide tracking tool that keeps all that information. We meet on a monthly basis, so case managers across the state are talking to each other. So we know when families are moving from county to county to county. We know what outcomes are happening. We know we work and collaborate with our continuum of care around housing, around our homeless providers, around our food banks. We work with diaper banks. We work with agencies, family resource centers, schools all over the state to make sure that we are helping those families who are choosing to use CSBG and all the other resources available to them to move forward. I don't know if that answers your question, but it is part of the planning process. How do we target those individuals? And that's why we want to know what's going on out there. So any questions, comments, or pushback about what we talked about so far before I go into the baseball analogy?
None from me.
Okay. All right, so let's go back to the baseball analogy. So we're using this when we talk about results focus, because what Dick just asked us is, how do we know we're getting a result, right? How do we know? We have to be accountable. So let's look at our local baseball team. The local baseball team finished last year. So in order to boost dwindling attendance, the team promotes that they are going to do all these things, right? They did all these things in the off season. They practiced more, they exercised more, they invested in the communication system, and by break time, they're taking more swings at bat than last year. Okay, so what does that mean? And the fans say, so what? Because the fans don't care about process if they don't get results. What they care about is winning. They're all about the results. You could say our fan base is results oriented. They've done all those things, but they have shown zero improvement. They are still in last place without a single player who deserves to be on the All-Star team. So what does that mean for community action? Well, when we change lives, and when we improve communities, that is how we score runs and how we win games. If we all tell the community, if all we tell the community is how much service we provide, it's no wonder that our fans may also say, so what? So what did you do? If we just say we hand out food boxes, what does that matter to our funders? We have to make it clear that what we do has profound impact on the lives of the people we serve. And just like that baseball team that has to hit the ball to score wins or to score runs and win, community action is not going to change lives if we do not deliver services effectively, compassionately, and intelligently. But you have to know why you're doing these services and what impact you expect them to have on individuals, families, and communities. So that brings us back to today, right? How will we know what we're doing is providing results? And how do we know where we even start? So to do that, we need to start at the beginning. We are all a work in progress. I'm just going to go over really quickly a brief history of ROMA in CSBG. In 1964, as I mentioned, we were part of the Economic Opportunity Act. In 1996, the planning framework was introduced, and then it was added into our authorization. By the way, we are tied up in the continuing reauthorization in Congress right now. So we are currently funded through February 2nd. We are hoping that that will be renewed. We have not had a reauthorization of the CSBG Act since 1998. We currently have the 2024 CSBG Modernization Act in front of Congress. We do not expect that to be addressed this year, based on the fact that it's going to be an election year. not a whole lot sometimes gets done in Congress on election years. Just to go on, in 2005, the federal government introduced NPIs. NPIs stand for National Performance Indicators. These are our goals. These are a collection of indicators that are similar across the entire country. Most community action agencies do the same services and they have the same goals. So this is a collection of those. So when we're comparing data from Wyoming to Virginia to Alaska, we're able to compare apples to apples. In 2012, there was a renewed focus of accountability under the administration, the Obama administration. They were like, look, you just need to start being much more accountable for the work that you're doing. So we came in and ROMA Next Gen was incorporated then in all aspects of the life cycle of CSBG funding and how it's managed at the national, state, and local levels. So in 2015, we adopted all of our organizational standards to make sure that our agencies have the organizational capacity to run this grant. And in 2017 is when the annual report was finally designed. And this is where there are thousands of us, every community action agency across the country turns in our data to the federal office to make sure that Congress has an accounting of everything that we're doing. That includes our outcomes. So this is all the ways that we see ROMA across our network. All of the ROMA principles and practices are embedded in these org standards, and many of the org standards are directed at the actions of the Community Action Agency's Board of Directors. So through the organizational standards, the ROMA principles are reinforced, and then they're expected to be supported and promoted by the board. So when we say we're in a work in progress, we're really looking towards the future, identifying a few things that we're going to highlight. We're going to look at how we deliver or deploy our services and strategies through a local theory of change. That's going to be a focus moving forward in Region 8, which we are a part of. This is North Dakota, South Dakota, Wyoming, Montana, Colorado, and Utah. We're addressing that by looking at how services and strategies are going to look in our rural and frontier states. Rural and frontier Wyoming looks very different than rural Tennessee. What works in rural Tennessee isn't going to work in rural North Dakota or rural Wyoming. So while we're working at the family or individual level is critical, we also have to understand that our role in working towards community change, how important that is. How do we collaborate with others in our community to develop economically vibrant communities with strong, healthy families where everyone has an opportunity to grow and succeed? CSNO and the state office, we're currently developing a manual for creating a data culture of showing everybody how to do data analysis and how that works at every level at our Wyoming agencies. And this guide is going to help agencies learn how to implement ROMA and find the connection between those identified needs, our population served, and our services and our indicators of change. This renewed focus isn't just about collecting data for reporting, but also, considering how that data can be connected, used, and communicated across our state and in your communities. All right, so before we move on, I want to check in, see if anybody has any questions, comments, pushback. Does anybody need to take a quick break or should we push on?
I say push on from here.
Push on from here? Everybody
Yep.
wants to get moving? Okay, we're going to do that then. All right, here you guys, you've heard me say it. This is the National Community Action Theory of Change. This is what national we look at when it comes to how we provide change in our networks. A theory of change is really just a way to demonstrate a very complicated nature of this network that's tied together by the common receipt of CSBG funds. So at the top, are the 3 community action goals that we have for individuals and families, for communities, and that we have families that are experiencing poverty, that we find ways for them to be engaged and active in building opportunities in their communities, giving them the opportunity to give back. In the middle, we see, where our services and our strategies are. This is where we work in many different areas of life. This is what we call our domains. So we work within employment, education, income, asset building, housing, health, social, behavioral development, and civic engagement. And then at the very bottom, you'll see our core principles and our performance management frameworks. This is how our network defines and indicates the importance and our ability to manage our performance and achieve our results. So I really want to draw your attention, though, to the very bottom of that graphic where you see our foundation. This is everything that holds this network together. And I'm going to read to you a national network of over 1,000 high-performing community action agencies, state associations, state offices, and federal partners supported by the CSBG funding to mobilize communities to fight poverty. That's a mouthful, but we know that there is a lot that goes into maintaining high-performing community action agencies. We have to have places for staff to work that meets their needs. That means we need to have clean, safe places for meetings and dialogues and access to current technology, having direct service and management staff that is properly trained, providing staff development as needed to assure that everyone is prepared to do the work that is so important that we're doing. We have to have quality staff and personnel and so on. There's so many things that we have to have as agencies to be able to do the work that we're being asked to do. These are not all that are identified here, but they may find their way into local theories of change as each agency assesses their own needs. Without spending time, energy, and resources on maintaining your local agency, the network is going to fail. Understanding what your own agency needs to do the work is essential in the implementation of a results-oriented agency. A common interest to all community action agencies in the network is being connected to your state associations, your state office, and your federal partners for all the support that we can provide, and then also being connected to the local community so you can all work together to fight poverty. It's these connections and these partnerships where our individual efforts and results are all added together into a single message, and it's our one voice that advocates on behalf of people experiencing poverty and their communities to demonstrate the positive impact of all of our programs and our services. Again, without spending time, energy, and resources on maintaining our local agencies, we can't do this work. So really, as a board member, understanding what your agencies, your subrecipients, the people on the ground doing the work is knowing what they need. It's just essential for them to be results oriented. The federal office, the Office of Community Service, where we get all of our guidance, is passionate about creating opportunities for agencies to be successful. And so they provide financial resources through CSBG grant funding in the state of Wyoming for agency capacity building, for paying for staff, for professional development and administrative support. They understand it takes a lot of people to do this work, and they're willing to pay for it. So that's something that a lot of boards are not always aware of. It's not always been super well communicated that there is funding through discretionary funds to be able to build agency capacity to do this work. So I do want to spend just a little bit of time on our core principles because this has not changed since 1964. Our mission has not changed since 1964. There have been these principles that we identify as our unique approach to problems associated with poverty. These were identified as the most common among our whole network across the nation. Your agencies will probably have some principles that are very specific to your community. And we really encourage those to be identified and publicized. And everybody knows what we are working toward in our communities. Overall, studies after study after study show us that poverty is not just about a lack of money. Of course, that's a basic truth, but it's also about a lack of resources. It's about barriers. There are resources in communities that oftentimes have limited access. Think about children in school and how some children cannot take advantage of sports or clubs because they don't have the funds or the transportation or the other necessities or a lack of skill, a lack of skills, and we could go on and on and on. So when we talk about the state being the equality state, what we like to talk about is the equity state, that everybody has access, not that everybody has equality, everybody has equal access. We also want to focus a lot on performance management because we do really value accountability. We value that at the local level, the state level, and the federal level. We do this through our organizational standards, understanding. ROMA is going to help you understand how the agency can meet and exceed basic standards. In addition to knowing how well your agency operates, the examination of what do we do, the network is funded to make a difference in issues related to poverty. So if your agency wants to develop a local theory of change, sometimes we look at those changes to make sure that we are still following all the network standards. And so we talk about those MPIs. We talk about our services and our strategies. So in Wyoming, some of our human service providers are focused on only one aspect of an individual's development. We call these domains, right? So the Wyoming Workforce Service Program focuses only on employment issues. Schools and colleges and apprenticeship programs only focus on education. HUD, or Continuum of Care, has a focus on housing related issues, but community action agencies like yours typically weave all these funding streams together to provide a range of services that are designed to meet multiple issues. Not every local agency addresses the same domain areas. Not every agency can be all things to all people all of the time. Every agency has to base its work off the assessment of the needs and the resources available in the community. So every agency is different. They all have a different set of services. They all have a different set of strategies that are going to be designed to match their community. The state does not come down to you and say, you're going to be doing these services. The board gets to decide what those services are going to look like. And you look at, because we can't be all things to all people all the time, we look at those numerous connections, our combinations, our relationships, our partnerships. We work with workforce development so we don't have to. Hey, you guys are the skill professionals in that. Let's have them do job training. Let's partner with our colleges and our university systems and our trade schools and our trade apprenticeship programs to help people learn how to earn a higher wage. But maybe that barrier is they can't afford the fire retardant clothes that they need to work on a drilling rig. Guess what? CSBG can buy that for them. So if they can get the training they need, we can help them remove that barrier of having the right, correct tools to do that job. We have to find our partners. We cannot do this alone. We cannot solely bring people out of poverty. We have to rely on everybody around us. These services and strategies that fall under the employment, the education, the income, housing, there are a lot of different services and things that we can do to address those things. But again, each one of those are going to be different for each one of your community, but these are the standards around the country. And finally, everything we do is in achieving these goals. In these 3 national goals that we have, the theory of change says exactly what our network aspires to achieve. Our goal is to get individuals and families to move out of poverty, or as the goal says, achieve economic security. But not only that, but we also want them engaged in their communities and their communities to be healthy and offer opportunities. So that is what a theory of change is. We do not have a theory of change in the state of Wyoming. It's a goal we have to set up. And we'll get there eventually. It's not something that has been formalized in Wyoming. And eventually, again, we'll get there. That'll be part of our manual about how we use our data. But again, I want you to look at the national theory of change and say, this is what we believe in, and this is how we're going to do it. And these are our goals. All right, let's start looking at the ROMA cycle. We're going to start looking at that assessment piece, right? So the first phase of the ROMA cycle that we're going to explore is that of the assessment. In most agencies, you're going to start with your most recent community assessment. In CSBG, we are required to conduct a community needs assessment every 3 years. Our organizational standards also identify the community needs assessment as supporting the org standards in several different categories. So in category 3, local control of federal CSBG resources is predicated on regular comprehensive community assessments that take into account the breadth of community needs as well as the partners and resources available in a community to meet these needs. That's literally what it says in our standards. In this screenshot of one of our community needs assessments, you can see that organizational standard 3.1, 3.2, 3.3, 3.4, 3.5, 1.2, 2.2, all refer, excuse me, drink of water here. All refer to how our community needs assessment is used to assess the community, how the data is used, how it's analyzed, how it's reported. One of the biggest things we use is standard 3.4 is to examine the key findings on the causes and conditions of poverty and how it impacts the needs of your community. And this is where we're going to find the top 3 needs identified in your community for our households, for our community, and for our agency. If you say the purpose of a community assessment is because it's required, yes.
Sorry. How does this assessment actually get done? How is that data collected? Where does it come from? You know what I'm saying?
That's a great question. So Christina, we do it a couple of different ways. We took a year off. So all agencies that were due for a community needs assessment this year got relief because we are in the process of revamping our community needs assessment. Primarily, we use data from the census, data from the census for your community, your county, that tells us everything, the ages, where we're at. We also go to the ASI, which is the yearly national survey of the American Survey of Individuals that give us the most recent information about poverty levels, age groups, house ownership, all of that is gathered. Our agencies in Wyoming hire a consultant to come in and do their needs assessment every 3 years. Those prices range anywhere from about $5,000 to about $25,000, depending on the size of the needs assessment. Some communities, and this is something that we're trying to build, Albany County is an example of a community who partners with our hospital. So IVNS is required through their nonprofit status of also doing a community needs assessment every 3 years. So they partner together with one consultant to gather all of this data. So this data is gathered through, most of it is through your census, through the State Information Center, through Department of Family Services around poverty levels, homelessness, food stamps, weatherization, utilization, WIC, those types of things. We also then require the voice of the user or that of the experience, the person with lived experience. So consultants come in, they have community cafes, they have roundtable discussions, they release surveys throughout the community, asking specific questions, in your case, about Fremont County. What is your knowledge about services that are available? How often has your family been hungry? So there are surveys that they combine in to get all of this information. It's really quite extensive. And that is why it's only required to be done every 3 years.
Okay.
Through the analysis of that, they then have to identify what are the 3 top needs in your community. So I will use the Bighorn one. Deb, that just came out. We just completed the one in Bighorn County, right? Well, we did. I know we did. And the number 1 was the housing domain, and the number 1 need under the housing domain was assistance around utility payments. So the services that we have to look at in providing in Bighorn County should be around utility services. Now, what should happen if the number 1 need in your community is childcare and your agency doesn't have the ability to provide childcare or to address a shortage of childcare? Then you can go into what's called a community initiative, and you can start building community ability to increase childcare. So there's a lot of different ways that we look at that. Just because it's in the top 3 of your needs assessment, we want it to be considered, but it doesn't mean you have to address it if that is beyond the mission of your agency and beyond the capacity of that. Does that make sense?
Sure. Thank you.
You bet. So very basic premise, a play here for a community action or through a community assessment, excuse me. A lot of times we do them because it's a box we have to check, right? You see on the sheet in front of us, yep, you gotta have your CNA, you gotta have that out, you gotta meet all of these things. And if that's the only thing people use their community assessment for, that's a crying shame. That's a very basic premise at play here, that it's needs-based and that we'll just adjust to it. But it can be used for so much more. It can help us identify families that are underserved or individuals that are underserved. We found in Uinta County that there was this certain population of Hispanic and Native American women that had a disproportionate number of people living in Uinta County and not being reflected in any of the services that were being provided by any of the agencies in Uinta County. And we were like, that's interesting. Did we create a barrier that made them feel like they couldn't come to us? It turns out we weren't providing any services or documents in a language that was needed. They didn't have it in Spanish. They didn't have anybody that spoke Spanish. They didn't have anybody that was able to work with somebody who spoke a second language. And so it looked as like, oh my gosh, we're missing a whole section of our population who's in desperate need of services, and we're not serving them, but we didn't know that because we didn't analyze the needs that we had in our community. So it's really a process that can help you really identify what adjustments can be made for maximum impact and effect. So it also can be used to offer what a picture of your community looks like at a point in time stuff relative to its need, both real and perceived, right? Sometimes there's a perceived barrier that's like, no, that's not true. We're open all the time. It may offer and create opportunities for community members to more closely examine geographic area and consider how it fits into your local region. Fremont County is extremely unique in that it covers the Wind River Reservation. The Wind River Reservation, I'm not telling Christine anything she doesn't already know, but they have two tribes that are on there. The Northern Arapaho receives its own CSBG funding. However, the Shoshone, Eastern Shoshone, does not receive CSBG funding. So when you look at Fremont County, which is the largest landmass county in the state, how are we able to provide services to meet the entire state? Maybe we need to look at our geographic area and consider how it fits into the region. And we also might use our needs assessment to look at the why beyond some obvious circumstances. Is poverty centered around a certain area in your community? Is there a certain place over by the tracks that maybe there's a large population of low people living in poverty that they're not able to access your services because there isn't local transportation or community transportation to get to you? We have that problem in Cheyenne. So the public transportation stops at 5 o'clock. And so people who use public transportation to access resources within downtown Cheyenne can't access it after a certain time. They can't get home. So that's something that we always look at. There are certain things that we want to know about a needs assessment. We know that it's a process. It needs to identify a community and our target population. It needs to provide a clear description and a specific cause and condition of poverty that are facing our individuals in our specific community. It is important that you guys go into a discussion about your assessment with some questions that your agency has identified. What do you want to know? Why do you want to know it? For example, you might want to know some specifics about poverty issues facing your community. Do you have a higher percent of families in poverty than the rest of the state or the nation? Is poverty concentrated in a specific area in your community? You may want to know what the people you serve think about their community. Do they have the resources they need to have stability in their family? Do they feel safe? Do they think that there are opportunities for them to improve their circumstances? Using information from local community needs assessments are going to ensure that your agency is focusing its resources on unique circumstances within its community. And assessing those existing resources also helps avoid duplication of services, allowing the most effective use of our agency's own resources. So, there are some really important things that we need to think about when we're talking about a needs assessment. Again, I kind of talked about this earlier. The state office right now is working on a uniform CNA format that's going to allow for communities to ensure they're gathering all the necessary CSBG requirements, but also standardize the form to allow for comparisons and analyses, I don't know, that's not the right way to say that, across Wyoming counties. But let's get back to our required elements. Right now, we know that the focus of an assessment has to be on those experiencing poverty and low incomes. But it's important to know the norms in your community and what we're using for comparisons. For example, low income in Teton County is going to look really different than low income in Albany County. Why might that be? You know, there's high wages in Teton County. Albany County has a different level of poverty because they have a lot of college kids, right? So it looks different. We need to know what's different. A lot of times, and most often, the assessments are done for the service area that agency covers, but sometimes these include many counties or represent both urban and rural areas, each with different needs and resources. So figuring out how to handle those differences should be included in your community needs assessment. And after data is collected, it needs to be arranged in a way that it makes it easy to look at the data from for different communities. So like I was in Johnson County, there's two communities, not real hard to compare data between two communities in one county. But Deb's in Bighorn County, where there's like 4 different school districts alone in her county. So it makes it different and difficult to look at how we compare that data. Another reason why we use consultants to put our data together, they put these in reports and formats that are easier for us to read. Some of our reports need to have different sections for multi-county areas. And so you want to make sure that when you're gathering that data in your community, you're seeing the whole community. And then you're going to want to sort out the data that's specific to individuals and families with low income. Is there a clear picture of who is experiencing poverty? Does poverty impact a particular age group? Is your older population poorer? Are there more senior citizens living on low fixed incomes? What trends are you seeing? Nationally, we're seeing a new level of poverty known as the working poor. We call that ALICE. And ALICE stands for Asset Limited, Income Constrained, and Employed. And that level of the population is growing. These are families where one or both of the adults are working full time, but still not earning enough to meet the family's basic needs. So it's important for board members to participate in this assessment process. But what role should you take, right? Some boards create a committee that work with staff to put together a plan for the assessment process. Some boards are like, I want to know these things. And if I'm going to hire you and I'm going to spend $10,000 on this, I want you to answer these questions for me, right? It's really good to have a plan going forward. I always suggest that there is an assessment team of some sort that will develop a plan before you get started with your project, because there's always going to be additional information about conducting a needs assessment, but this is just an overview. You guys all represent different sectors of your community, and as such, you bring a range of experiences and perspectives and knowledge. You have your own opinions. You bring survey responses. You can put different questions in there. You know, business people and policymakers and other people who need to be involved in this process probably more easily than staff knows how to do it. In Wyoming, it's, even though we do hire consultants to do most of our work, in Montana, the agencies do this themselves. I don't know how they do it. Honest to God, I don't know how they have time to do it, but in Montana, they do it. And here, it's like, it is so much more helpful if board members can come in and bring their expertise in. We want to talk about quantitative data, right? Qualitative versus quantitative data. Quantitative, if you think of quantitative, you think of the N. We're looking at numbers. This is where we get our U.S. Census Department numbers. Sometimes we use mapping to identify where certain demographic groups are located. Do those areas have access to affordable fresh food or transportation? And then we also use qualitative data. That's the L. This is where we find data that we use customer satisfaction surveys, focus groups, those with lived experience, community cafes, listening sessions. But then again, like I said, we have other partners in the community. We want to send the survey out to business people. They have a unique understanding around topics like the need for education or specific job skills that are lacking in the community. It's like, yeah, we'd like to hire people, but we don't have anybody that has the job skills that we're looking for, or we're experiencing tremendous employee turnover, difficulties in recruitment. We can't pay the wage that people need to afford rent here. There's all these different things that they're looking at. So you want to make sure you get these people involved with your survey so they can find and they can contribute. You want to look beyond the services you're providing. Look at the number of times you were also unable to assist an individual and why. And you're going to get different information from each of the different sectors that you look at. You may find there isn't much affordable housing in a low income neighborhood, and that the cost of formerly affordable housing has risen so dramatically over the past 5 years, you can tell that that's a community level need that affects everyone in the community. This has to be addressed by creating more affordable housing units. It cannot be solved by helping individual families pay rent. But what are people with low income saying about this situation? What are they saying? Are there other service providers that are working with low income populations saying something different? Does the business community, like I said, have something to say? Does the banking community have something to say? If you want to find out what it means to the individuals and the families living and working in that community, you have to ask them, how do they manage to pay for high housing costs? Those, that and high housing costs, we count that as anything that's more than 1/3 of their gross income. Would they be willing to move if they could find a less expensive apartment, one that was safer, one that was more energy efficient? What resources would they need to make such a move? We talked about now having to put down deposits of first and last month rent and security deposits and damage deposits. And there's so much that we don't know if we don't ask the questions. And we also have to ask what our agency level needs are. We talked about interviewing community members and our partners and those with lived experience, but we should interview our staff as well. I just lost my train of thought here just for a second. Oh, yeah, we talked about interviewing all those people, but have we interviewed our staff to assess what's missing at the agency level? That can be eye-popping, right? That can be like, oh my God, I didn't even know we didn't have that stuff. If we don't have the right training or the staffing to address the causes of concerns of poverty, we need to look at why. It's the board's responsibility to ensure that the agency is stable and sustainable. CSBG recognizes that value and the importance of having well-trained staff, and CSBG funding can be used to pay salaries and fringe benefits to employ case managers to work with families in crisis. Some agencies don't have enough CSBG funds to provide case management, and they may look at providing emergency services only. We talked about those differences in those types of services. But the only way you're going to know what is going to work best in your community is through your needs assessment. It's the only way, right? So now what? We have to make information out of that data. So as a board member, you're going to have all this data in front of you, right? You're going to have a 200-page report in front of you, and you're going to want to make this data make sense. Many times the staff collects and aggregates this data, or that, like I said, a consultant is hired to produce your report, and this giant document is delivered to the board for consideration and approval. That document is going to require considerable time to read and analyze what is being presented. Does the data you collected provide you with the answers that you want? Data that hasn't been analyzed is not helpful. It's just a collection of stories, numbers, and endless information. We need to find ways to make that whole collection make sense somehow. We have to ask ourselves, what do we want to know, and how and why do we want to know it? And that's going to be a part of the manual that we're putting together. We're going to give you a list of questions you should be asking, right? We have to make that data make sense. So once we do that, we have to prioritize our needs. Often we hear that customers are given a survey asking what service they need the most, and that service rises to the top of the list because it has the most people who select it, and that becomes the agency's top priority. But how do we go about prioritizing needs? Sometimes the issue that raises to the top is something that the agency has not been addressing, and I kind of referenced this a little bit. Let's use the example of employment. Our community needs an assessment indicated that people need better paying jobs. With better paying jobs, they can afford safer or more stable housing. If that's an issue related to providing skill development for individuals so they can qualify for better jobs, your agency may be able to provide that assistance, either directly or through a referral to workforce services. But if there are not better jobs in the community to be had, then the task becomes one of creating or stimulating the creation of higher paying jobs with benefits. That is a much more difficult problem. It cannot be done by the agency alone. It probably cannot be done within the next program year. And while the agency has been involved in job training and employment counseling, it has never been involved in creating job opportunities before. So what does the agency do with this top priority need? That's a question the board has to ask. Other times, that top priority might be something outside the current mission of the agency. The agency's theory of change or mission focuses on how they are going to prepare, for example, children, how to prepare children for school. But the top priority that the community lacks, according to the needs assessment, is affordable housing. Well, the agency's never had any programming related to housing issues before. What does the agency do? How does the board make these types of leadership decisions? There's a lot of different techniques to use to prioritize these issues. We can use force field analysis, the 5 whys, setting up a matrix, cost benefit analysis, blah, 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 blah. But regardless of your process, there are going to be situations in which your judgment and your judgment calls are going to be required. One segment who provided input maybe thinks X is the biggest need, and another segment thinks maybe it's Y that's the most important need. When you move to the planning phase, you're going to consider many different factors, and those top needs are going to change. It may change. They don't have to change, but they may. And it's important to be clear with all the participants in the assessment committee, whether their votes are binding or simply recommendations. It's also important to be clear about whether certain individuals have the power to make judgment calls and or to eliminate priority areas based on other factors. This process is not easy. It takes considerable time and effort to determine. So, it's like, oh my God, what are we going to do with all this information? That's why we only do it once every 3 years, because it is a huge process for us to go through. So what does a board have to do once you get your CNA? You do have to strive to have an agency-wide comprehensive CNA. You do have to approve the CNA and record that board action. You should identify a planning committee who's going to take that assessment data to consider in developing an agency-wide strategic plan, and then use that data to inform your local theory of change. All right, any questions? That's a lot of information, right?
Yes, it is.
It is a lot. I know. And it's like, oh my God, how are we going to do all this stuff? It's overwhelming. I don't know how to do this. This is why I'm here. So as your state association, I'm the one that comes into boards, and I'm the one that does the process of doing the assessment with your board and your executive directors and all your subrecipients. And we sit down and we do this process, and we're like, okay, how are we going to do this? How are we going to formulate this, right? That's why you guys are members of CSNO, because you get the service of having action plan, facilitation, strategic planning, and I help you come in and do these things. It is a lot of work, and we're really building a system and a culture in Wyoming to have this be a part of our everyday process, so it doesn't feel so overwhelming all of the time. All right, before we move on, I just wanted to check to see if anybody had any questions, comments, or pushback.
I do.
Okay. Yes.
This is Dick from Sheridan. I may have missed something. Can we get a hard copy of this stuff?
Yep. I am going, at the end of our 3 sessions, I am going to send these out to you. Plus, I'm going to be sending out a bunch of materials about the organizational standards. I have, and Anne has all of this information. I'll be coming.
Okay,
to
so
you guys-
she's got it, that's fine.
Yeah, she's got this. And for Christine, I'm working with Doug on getting he has all this stuff as well as we're going through the organizational standards. He's part of
Great.
Go ahead.
Great.
Yep, he's part of our Wyoming data project, so he's helping us build this. He's a gem. He's awesome. He is doing some tremendous work. It's kind of been a slow start for him. There's been some barriers, but you know what? We're working through them. And then next, really, we're done here tonight. We're going to meet next Wednesday at 5:30. We're going to go over mission. We're going to talk about our mission aligning with the work around poverty. We're going to talk about determining our needs at the individual, community, and agency level, determining levels of change so we know what change looks like. And then we're going to talk in much more detail about that strategic services and case management versus emergency management in much more detail, and kind of what that looks like. So I look forward to seeing you guys here next week. Please feel free to reach out to me with any questions, or to your executive directors, Anne or Doug. Again, I will follow up this series with all this information. I do want you to know that because you guys are participating in this, you're helping your agencies meet some of the organizational standards, which is making them very happy. So we appreciate all the work that you guys do, all the time and effort. Oh, I've moved my screen here and I don't know where my mouse is. Okay. All the time and effort and that you guys give to your boards. Your work is why this happens. It is so important, and I want to thank you, and I want to thank you for taking time and spending it with me. At the end of this, there's going to be a survey that pops up. Please take that survey and let us know how we can do this better, and how we can serve you better. And then I will see you next week. Bye.
Thank you, Sue. And I'm glad that you're giving us a copy because I've been taking notes and I'm
Yes,
hoping I can read them.
you guys are going to hate me because I'm going to give you so much information. You're going to be like, oh my God. All right.
All right.
Thanks, guys. Have a
Good night.
Good night.
Thank you.
Thank you. Bye-bye.